Week 1 is in reference to the False Claims Act. The False Claims Act was enacted by Congress in 1863 at the height of the Civil War. It is sometimes referred to as Lincoln's Law. So in prosecuting that war, the federal government used a large number of private contractors, some of whom took advantage of the situation during the Civil War and made false claims for payment, such as giving the troops or selling to the troops inferior combat boots. So the False Claim Act was designed to address those issues. False Claim Act has been responsible for returning lots of money back to the government. In fact, in 2007, the United States government, under the False Claim Act, recovered over $2 billion, that's with a B, over $2 billion in settlements and judgments in fraud cases, and over $1.5 million, in over $1.5 billion of that recovery was due to fraud in the healthcare industry. So providers should be concerned about many areas, and some of the areas that providers should be concerned about that places them at risk is, for example, unbundling, right? So unbundling is when the provider bills more than, say, one CPT code, when in fact one CPT code will adequately describe the service or the procedure. Also billing for medically unnecessary services. So medically unnecessary services are services that in the government's eyes is not considered necessary. Now that could be an unnecessary procedure, or maybe the diagnosis just is not considered medically necessary for the specific procedure. Many providers also should be very careful in reference to not getting involved in anti-kickback. So the anti-kickback statute was actually enacted as part of the Social Security amendments back in 1972, and the anti-kickback law prohibits anyone from offering a kickback, paying a kickback, or receiving a kickback in return for delivery of any kind of services. Now, in addition, there is the issue of upcoding. So upcoding for a provider would mean that they are billing a higher level of service than could have been provided at a lower service, or the documentation actually supports a lower service than the code that was submitted for payment. Many of these False Claim Act recoupments are due to a whistleblower. A whistleblower is oftentimes referred to as a relator. And if the relator brings a case to the government, and if the government chooses to take the case, the whistleblower could actually receive up to 25% of the recoupment. In addition, the attorney fees would also be recouped. If the government decides not to take the case, the whistleblower can go ahead and take the case to court on their own. There is also an issue under the False Claim Act known as a reverse false claim. So basically, a reverse false claim is a provider knows that they have received an overpayment, and instead of repaying the overpayment, they keep the money, and that is known as a reverse false claim. In fact, the government says that any overpayments should be sent back to the government within 60 days of discovering that an overpayment indeed has been received. Now, providers that should be concerned with the False Claim Act includes not just physicians, but hospitals as well, skilled nursing facilities, drug companies, pharmacies, ambulance companies. So it's the whole range of anyone involved in the healthcare industry. Now, there are plenty of cases you can Google on the internet that discusses some of these false claims. For example, WellCare Health Plan even had to pay back over $137 million in order to settle 4 False Claim Act cases that were brought by a qui tam whistleblower, alleging that the health plan inflated the amount that it claimed to spend on medical care, knowingly retained the Medicare and Medicaid overpayments, and also cherry-picked healthy healthy patients in order to avoid the cost of treating the sicker patients. So, regarding areas of concern, providers should also be concerned with billing for services not rendered, billing for patients maybe they didn't see but they billed for anyway. So do take some time and read through the OIG compliance plan that is listed under the web links, and you can get an idea of what some of these issues are. Please let me know if you have any questions. Thank you.